Canada is probably the healthcare model Americans hear about most often when the phrase universal healthcare enters a political conversation. It is also probably the one most often misunderstood. When many Americans hear single-payer healthcare, they picture a government system where the state owns the hospitals, employs the doctors, and controls every medical decision. That is not Canada. Canada is a single-payer system. The simplest way to understand that is this. The government acts as the insurer. It collects tax revenue and uses that money as one large public insurance pool. When a Canadian resident needs medically necessary health care, such as a hospital stay, surgery, or a visit to a physician, the patient generally does not receive a bill. The government pays the provider directly. There are no competing insurance companies trying to sell you a different plan for those core services. There is one primary payer, the government, one country, multiple health plans. Even the phrase the Canadian government needs some clarification. Canada does not have one giant healthcare office in Ottawa managing every doctor's appointment. Healthcare is primarily administered by the provinces and territories. The federal government establishes the national framework through the Canada Health Act and provides funding support, but each province operates its own health plan. The federal government essentially sets the ground rules. Those rules require that provincial systems cover all eligible residents, be publicly administered, provide access to medically necessary hospital and physician services, allow coverage to follow residents when they move or travel within Canada, avoid patient charges for insured services. If provinces fail to meet those requirements, the federal government can reduce funding. The result is not one identical national program, but a collection of provincial systems that operate under the same basic principles. What does covered health care actually mean? This is where the phrase free health care becomes more complicated. Canada provides universal coverage, but not universal coverage of everything. The key phrase is medically necessary. Hospital care, physician services, and certain diagnostic services are generally covered, but outside those areas, coverage varies. Prescription drugs taken outside a hospital, dental care, vision care, physiotherapy, long-term care, and many mental health services are often handled differently. Some people receive coverage through employers, some purchase supplemental insurance, some qualify for provincial programs designed for specific groups, such as seniors, children, or low-income residents. So when someone says, Canadians have free health care, the more accurate statement is, Canadians have publicly funded access to medically necessary hospital and physician care. That distinction matters. Canada removes the fear of receiving a massive hospital bill after an emergency, but it does not mean every healthcare-related expense disappears. Public money, independent providers. One of the most important things to understand about Canada is that single-payer does not mean government-run medicine. Most Canadian doctors are not government employees. Many operate independent practices or work in group clinics. They bill the provincial health plan according to negotiated fee schedules. Hospitals are generally publicly funded nonprofit organizations that operate under government budgets rather than charging patients individually for every service. In other words, public financing, private delivery. The government pays the bill, but the doctor is often still an independent professional. This is why Canada is often used as an example by supporters of single-payer systems in the United States. The concept is not that government takes over every medical office. The concept is that one public insurer handles payment while providers continue delivering care. The trade-off, the waiting room. Every healthcare system has trade-offs. Canada's most common criticism is not usually access to emergency care. If you are having a heart attack, you are treated. The debate centers more around non-emergency care, specialist appointments, elective surgeries, and procedures that are important but not immediately life-threatening can involve waiting periods. For many Canadians, the question is not whether they can eventually receive care, but how long they may have to wait. That creates an ongoing debate within Canada itself. How much should a system prioritize equal access? How much additional capacity should be funded? How much room should exist for private options? These are not simple questions, and Canadians themselves continue to debate them. The Canadian model, in simple terms, Canada combines universal coverage for medically necessary hospital and physician services, one public payer, independent doctors and healthcare providers, provincial administration, federal standards, tax-based funding, limited private insurance for additional services. It is not government-owned healthcare. It is government-funded healthcare. That difference is important. You will find a handy table in the accompanying text,